Hey friends, Assalamu alaikum. Today I'm excited to introduce you to one of my favorite seniors and the person who cracked NEET PG in his very first attempt with an astonishing All India rank of 220. It's Dr. Thanveer VT. So let's ask how his NEET journey was, what are some of the mistakes which he had made in his journey, and let's hope to gain some inspiration and advice as to how to crack NEET or next after MBBS. If you're new to this channel and if you haven't subscribed yet, myself Omar Mohammed, I am a final year MBBS student studying at Calicut Medical College. What are you waiting for? Just hit the subscribe button, like this video, watch the entire content, and if you found this content to be helpful, make sure to help your friends as well by sharing this video. So let's start. Before we start the interview, let me introduce you Cytokine, who is kindly sponsoring this video. Cytokine is India's first practical-based clinical app designed for medical students and for general practitioners. They provide courses on primary care management and UG clinics. In fact, Dr. Thanveer is one of the co-founders of Cytokine, and the best part is they are providing a limited time free 7-day trial plus an additional 20% offer on their courses. So do check out the link in description, and if you're interested to know more about Cytokine, just check the timestamps of this video. So now let's get back to the interview. Good evening, Thanveer. Thank you for your time. I'm delighted to have you on the show here. So it would be nice to introduce yourself to our audience.
Thank you very much, Umar. So myself, Thanveer, from 2016 batch of Calicut Medical College, also known as the 60th batch. And I personally, I finished my graduation on 2022 November, and I secured a rank of 220 in this NEET PG 2023. And recently, I have joined for MD General Medicine at my same college, Calicut Medical College, and our course is about to start in 2-3 days, hopefully.
Yeah, that's pretty impressive. One thing which I would like to tell about Dr. Thanveer is the relationship we have with each other. Thanveer is one of my favorite seniors in our college, and I have to speak about the other side of Dr. Thanveer. It's not just about the academic side, even though that's what we are going to focus in this video. But I have to say that he is a very humble person, and he's one of those persons I know from my first year itself. To speak about his other side, he actually was the batch representative for 2 years during his MBBS days, and he was a very active member in various other activities, and he was an active member of the college union as well. And also, moreover, he along with his friends, they run a startup for medical students by the name of Cytokine, which we'll also discuss in this interview along the way. So that's another part of Dr. Thanveer which the audience must definitely know of. So with that brief introduction, let's start with your NEET PG journey. So how was your journey like? When did you begin your preparation? Was it during your internship, before your internship, or after your internship? So when was that moment you decided to go all in on for the NEET journey?
Thank you very much. Thank you very much, Umar, for those good words. And though I don't deserve all of that, so but anyway, about my NEET PG journey, if you ask me, like, when did I start learning? Per se, like after entering the MBBS course, initially in the first year, I was like, as everyone would be, I was not understanding the language of medical science per se, particularly in the anatomy subject and all. So I found it difficult to learn. So in the first year and second year, I did not go for any coaching or anything. I just wanted to get acclimatized to the subject and the topic and to the environment. So I started this coaching series or to attend the coaching classes in the last period of my third year, and I attended ENT classes during my third year, which was from Marrow. And in the final year subject, when we entered the final year, the COVID started, and for that time, I completed my final year subjects during that COVID period, most of them. And I could not complete everything, like medicine, I could not complete completely. And surgery also, I could not finish it completely. But other subjects I managed to complete during the COVID period of time. At that point of time, if you ask me whether the PG entrance was there in my mind, I should say no, it was not there in my mind. What I actually targeted during that period of time was to clear my MBBS final year exam with a good score and with confidence. Because what I lacked during my first year and second year was the confidence that during the exam. Because I did not know all the subject, complete subject, and I usually learned very much the selection topics, and I used to select some more selection topics among those selected topics even.
Yeah, that's what most of us do here.
Yeah, that is what we do always, and usually seniors gives us the selection topics. We do some selection topics for ourselves also.
Yeah.
So when I did in that pattern, every day when I go for exam, it was too much in panic. Like uh, we don't know what exam, what might turn into, what will be the questions coming on.
Yeah.
So in order to counter that, and I did not want that to happen to my final year. So that is the thing why I got into a coaching platform and I learned for entrance. So if you ask me what was the start, that was the start. Third year ENT was the first subject which I attended as the entrance coaching pattern of learning. I did not practice any questions that time. I did not practice MCQs or anything that time, but I learned in that. And during internship, I could not get too much of time for learning. Though there was many time that we can learn, like during the SPM postings and psychiatry posting.
Something which I think most people don't say, especially in our college, considering the hectic internship. Like I have heard most of the seniors say that everything that they have done till the final year, by the end of that internship, within that 1 year, everything just fades away due to how hectic the internship in our college is.
Yeah, that's what happens. Like during the surgery, or like ortho, OBG, and medicine postings, it's a very hectic in our college,
Yeah.
and the caseload and everything. So we don't get any time to revise or to learn things. We get into that. And when we are after the postings, like almost 6 months, these hectic postings will be there. And after that, when we get a free time or leisure time, we would give more importance to get the leisure time and to get the hobbies and
Yeah,
to enjoy and have fun rather than reading and learning. So the same happened to me also. So during my internship, there was a break actually. Like 1 year, I was having a break of not learning anything. But after that, our internship was over by August 16th, and our convocation was over by September 4th. So after September 4th, I started learning seriously from September 10th onwards. So September 10th to March 5th, that almost like 5.5 or 6 months was my core preparation time. So during that time, I had only one thing in my mind, that was preparation and to clear my NEET PG entrance exam. There was nothing else in my mind. There was nothing which I did other than learn. So that was the most important time which I targeted NEET PG, and I learned for NEET PG.
So essentially, it was the last 6 months after your internship where you went on and on for NEET, but your foundation was built on your final year.
Yes, yes. Mainly the final year subject was clinical subjects were good during the final year itself. So one thing that I did during this preparation that is that because the first exam which I was able to attempt was the INICT November, because we were not eligible for the NEET PG of 2022. The Kerala students were not eligible that. So INICT November was the first exam. So what I did was that INICT is an exam which more concentrates on first year and second year subjects, mainly the preclinical subjects. And most of the 60 to 65% of questions come from preclinical subjects. So what I did was, since my ENT and the final year subjects, which I know something, so I kept those subjects there and I started learning from the first year and second year subjects.
Okay.
So these first year and second year subjects are also known as the rank building subjects, because these subjects, if you are having a good score, or if you are learning that subjects, you will be like almost scoring like 100 to 120 correct responses, which means that that is a rank building subject. If you are not learning these subjects, that means you will not be there in the list. So after that, so I could complete that subjects, first year and second year subjects completely before the November INIC. And I gave one time of revision in that subjects also. And final year subjects, I just had rushed through. I did not read medicine and surgery and all, but just rushed through the subjects, and I had a bit of idea in that subjects also. So I just attempted the INICT. So in that INICT exam, I got a rank of 2,500. So that was a great boost for me. Like getting the rank of 2500 without completing the whole syllabus, and but giving the importance with the revision and all. So what I understood is that at that point of time, if I give my 100 percentage, if I can finish all the other subjects also in this method of learning, then I can get a good rank in NEET. So I was sure at that time. And at that time, I also called many of my teachers who helped me during the learning process. For example, Rahul Rajiv sir of Dr. I called him and I said him that sir is a guide for me also during all this learning process. So I asked him about the strategy which I have to take during that time. So what sir said is that 2500 is a good rank. At the same time, it is a trap also, and do not fall into that trap, because when you are getting a rank of 2500 without much of effort, you will be into a like getting into a field like that. Even if I am not putting too much of effort, I can get a good rank in NEET PG. So don't fall into that trap. It was a good guidance that I got that time. So I did not fall into that trap. I continued learning. I continued giving my complete percentage and good effort for the exam, NEET PG exam, and finally I cleared the NEET PG with a good rank. So what helped me is that the notes which the thing that I did is that, as I said you before, the ENT subject and also the final year subjects I had prepared. Previously, I had the notes, so I did not watch new videos for those subjects. I used the same notes. But the first year and second year subjects and the third year other ENT and SPM, I watched new videos from DAMS basically. DAMS videos were very useful for me, because when we compare with Marrow and DAMS, what the thing that I felt very different is that DAMS notes are very short and very crisp, which is very useful when it comes to the preparation time is very short. When you have a very short preparation time, DAMS gives you good results. So I had watched all those videos, and then that helped me very much during the exam. So this is the way which I prepared, and uh, the NEET PG journey, if you ask me, the most important thing is the revision. So for the revision, I had kept almost like 2.5 months. Like from December 15th, I started the revision. So I did 2 times of revisions only. Ideally, we say that you have to do 3 times of revision, but I could not complete that. I was a bit slow when it comes to revision. So that is the way, that is my NEET PG journey in short.
That's an incredible journey, which I think will inspire many as well. But what do you think are some of the mistakes which you have made across this journey, which you think it would have eased my preparation? Maybe I should have started earlier, or maybe I shouldn't have done this or that. Some sort of mistakes which you think, if any, which you think you could have improved upon.
Nobody's journey is perfect. Everyone will have some problems, issues, mistakes during their journey. So it's better to have to know the mistakes which others made, so that we can correct them. I also yeah, went through many of the videos and interviews of many of the toppers, and when came to know what are the mistakes that they made, and I used to correct them. So the mistakes which I made was, the first thing was, during the start of the preparation, I had only one thing in my mind, that I have to finish the first year and second year subjects before the INICT exam. So I just struggled for that. So I just the number of hours of lectures that will happen, and I divided the number of days. So what I was doing was that the aim that I had was to complete 10 hours of lectures per day. Just not 10 hours of watching. 10 hours of lectures should be completed. That means 10 hours, it might take 12 hours sometimes. Some teachers might be very slow, so that you can watch in 1.5x or 1.7x, so that at that time you will be taking only 7 hours. So that depends on the teachers and the speed of teachers and lectures. So 10 hours of lectures should be completed per day. That was my target. So when I was doing that, after the 10 hours, it might reach 9 hours, like, or 9.5 hours. Sometimes I can reach, I'll be exhausted, very much of exhausted. And there was no time for me to read the same note on the same day. So I just keep on watching the videos, but I did not read. So what happened is that after I completed biochemistry, when I thought back, I did not know anything from biochemistry. After I completed physiology, I did not know anything from physiology. So it was like I'm just watching the videos and going through, and I'm not reading them. So I understood that this is a big problem when the November INICT exam was near. So November INICT exam was on November 13th, I think, 13th or 11th, I don't remember the correct date. So I just stopped on October 20th. So that means 20 days before the university exam, I just stopped. And what I did was I took these 20 days to read all these notes which I made. So the mistake which I made, like, is that I did not read the same note on the same day. That was a big mistake because even if I had watched only 8 hours of lectures and used the other 2 hours just to read that notes, that would be very much useful for me than doing this. So what happened is that I had to find a 20 days, different 20 days for reading. It was the problem of the mistake which I made. And also in those 20 days, what happened is that when I started reading, I found that everything in the note is new. So that was also a problem of not reading on the same day. Because if you are reading the same thing on the same day, it will be very easy to understand the concepts which you learned from the class will be too much cemented on your brain on the same day if you are reading on the same day. So it is not like it is impossible like to learn everything on the same day. It is possible to read everything. Like if you watch like almost like 10 hours of a lecture or 8 hours of lecture, it would take almost like 5 hours or 6 hours to learn all this. But it would take only 2 hours to read all this. Learning and reading is different because learning means you have to understand the concept and you have to know what are the things and everything. The learning and reading. So the reading process is important every day. Whatever you watch, you have to read on the same day. You have to learn it by a process like almost like one month later or anything. So the mistake that I did was I did not read the same notes on the same day.
I think that is one mistake which even I'm making right now, and I think many of us could actually relate, especially those who are subscribed to these platforms like Marrow. As you might know, in Marrow, the medicine modules are too long and too large, so it takes like more than 1 month, even if you watch like 10 hours of content. So the mistake that even I did was during my medicine posting, I was trying to finish. We had a 1.5 month posting, so within that 1.5 month posting, I just wanted to get done with those videos. But the issue was that after 2 days, if you ask me what do I remember, I don't frankly remember anything. There is just bits of information here and there which I have heard. That was the situation, and by the end posting and theory examination, it was as if I was learning it for the very first time.
Second mistake which I made was like I said you that I could not complete 3 revisions. So that was mainly because my first revision took too much of time and I was very slow during the first revision. So I took almost like 2 months for my first revision and 15 days for the second revision. So that was the time limit that I got. So the main problem was that I said you that I did not read much during the first time of learning that, which also affected the revision. Like when I revised anatomy, I did not know many of the relation and everything. I could not learn in a good manner. So during the first revision, I took too much of time so that I can understand the concepts and clear the concepts and go. So in one way, the slow revision helped me to clear the concepts and make the concepts clear. But in one way, it made me too much of panic because there is a known rule which everyone says in YouTube that you have to complete minimum of 3 revision and 4 revision is very good. So I was too much obsessed about this 3 revision thing, which like haunted me even just the day before the exam. I was just thinking that everyone might have completed 3 revisions. I have only done 2 revisions. But in the end, it did not matter much. But I also think that if it was a 3 revision, it might be a good result, better result than this.
Okay, so the two mistakes for the audience. The first one is to revise the modules while you are studying itself, and the second one being try to revise at least 3 times and make a schedule according to that.
One more thing, for the INICT exam, which I thought, the November INICT exam, which I attended, I could have got a good rank or better rank if I had done the previous year questions. I did not do any previous year questions for that INICT exam. So that was a big mistake because when it comes to INICT exam, there is too much of previous year questions which are being repeated and asking in the same manner. Similar questions are being asked always. So the pattern did not follow that much during the last May INICT exam, but in the November INICT exam, there were too much of previous year questions, ditto questions were there. So I missed many of them just because I did not do the previous questions. So that mistakes should also be avoided. So during my NEET preparation, I had just 15 days before NEET, I did all the previous year questions of NEET and also the FMG questions, because FMG exam is also being done and conducted by NBE board. NBE board is conducting both the NEET exam and the FMG board exam. So the examiners and the exam type would be more of a same kind. FMG exam is also a bit of NEET level right now. So
Okay.
we are getting too much of NEET level questions there in FMG. So I got a ditto same question, same figure, same marking of Fossa of Rosenmuller of ENT from the FMG questions. The same question was there in the NEET PG question. So if you ask me about out of 200 questions, 20 of, I think almost 20 questions were ditto NEET PG repeats, NEET PG and FMG repeat questions. And other like almost like 50 or 60 questions will be like previous questions or related questions, and only the other questions are being the new questions are which have been come, which are also from the most important topics. So doing PYQ is also very
Okay, so with that, I guess, which year do you think, if one is setting out on that NEET journey or the next journey, which will be from the next year onwards? So for next year NEET, which year do you think is the best time to actually start your preparation? And also, let me just take you through my preparation. So right now, I am watching the main videos in Marrow and completing the Q bank as much as I'm possible. As you know, there is a time limitation, or it's just an excuse that we tell to ourselves that there isn't enough time, but that's the situation. But what do you think is the best strategy? Should we go for revision videos, or should we focus on previous year, or the complete main module at different stages?
yeah, of course. So if you ask me the best time to start, best time is the early time. The early you start, the better it becomes. That is the
Mhm.
best thing that I have to say. But I'm not suggesting to like start it from the first day of the first year itself. Like you can take first year lightly. You can get to know about the dissection and everything, and know about the subjects and everything. Second year would be a good time that you can start, because second year subjects form the many of the basics for the entrance exam, and also the basics for the subjects to come, pharmacology, and pathology, and also the um, secondary
Microbiology.
subjects like microbiology. Yes, this forms the basis for the medicine subjects per se. So if you are clear and good in these subjects, you can clear many of the medicine questions also. So second year would be a good time. I started the third year because third year was relatively cool. But second year and third year would be good. I'm suggesting you have to start any time before final year, because final year you will be like more concentrated on the passing the final year and being a doctor and becoming a doctor in that journey. So you
Yeah.
might not be getting too much of time for preparation first, though both are
Mhm.
same, but both are different also at the same time. So that would be the best time. I think second year or third year would be a good time to start.
Mhm.
And about the revision videos which you asked, like the main thing, main concern comes when it comes to the subject of medicine, general medicine. So as you know,
Mhm.
general medicine covers everything, and it is not possible to say that this is not general medicine, this is not general medicine. Everything will be there. So when going on a platform like Marrow, Rakesh sir teaches everything in a great detail, and which makes the subject interesting and too much of knowledge to us. But at the same time, the video becomes, the length becomes very much of too much, and which is also a concern. So the issue that I had like was also with general medicine, because I had the Marrow notes of general medicine, but I did not complete. And I had like almost 80% of the content with me, but I
Mhm.
had 4 or 5 notebooks of general medicine. So I would look at them, I will feel all the fear in me, because like all, if I am stacking the first year and second year subjects, it won't come as a medicine subject per se. So it
Mhm.
feared me very much. So I was too much of concerned of that. And when I did the questions from medicine per se, medicine, if I did a GT, which is the grand test, which I said,
Yeah.
if there is almost like 18 or to 20 general medicine questions, I almost got 13 or 14 correct, even if I did not read it. Like
Mhm.
with my knowledge from pharmacology and microbiology and pathology, I could clear the questions from medicine, except the pure medicine questions. And also like vitamin, etc. questions are also considered as medicine questions, but at the same time, these are being taught in biochemistry and also in SPM also, or PSM also. So I could get answers correct. So what I felt is that though I have not read all these notes, I am getting a pretty good score in medicine. So I just left that books there. I did not read that again. What I did was I attended another revision class of 3 days for medicine, and I just got the notes. And I attended the NEET PG exam with a medicine knowledge from that revision notes. So when it comes to subjects per se, when you are learning in a final year or when you are learning during the learning process, I don't suggest reading the or watching the revision videos, because at that time knowledge building is very important, because when you watch the revision videos, only the most important, the most crisp knowledge will be given to you. But uh, knowledge always is very much good for you. Too much of knowledge is bad, but too much of knowledge is bad in the sense that at a bad time, because like any time the knowledge is good, but when you are preparing for an exam, yeah, if you are getting too much of knowledge, you are not able to revise, then it is not use. So um, at that in that way, so if you are in failure, it's better you can watch the whole
Main one.
main videos. And in medicine, I can suggest, if you want if you are good with the theory and all, and if you are confident with the final year exam per se, and you are watching the videos only for the entrance preparation need, then I think the revision videos will be some that will be.
Mm. Mm.
For entrance preparation person for medicine, I think revision videos will be enough.
Will be
Uh,
better.
there will be difference of opinion from different persons, because what
Yeah.
I'm saying is from my perspective, because it will be different. Suppose if you are doing a GT and you are getting only 3 or 4 correct from out of 20 questions, definitely you have to watch all the videos of medicine. So it will
Mm.
be varying from person to person. But I think most of the I watched many of the videos of the toppers also. Many of the interviews, many of them said that they skipped medicine for learning during the entrance exam, which was like not believable for me, because when
Mm.
it comes to the bulk of the subject and 200 hours of videos, we are skipping all these. How are
Yeah.
you going to clear the exam and 20 questions at a time? But the fact is that when you are good with the microbiology, pharmacology, and everything, medicine is a combination of all these subjects. So the questions can
Exactly.
be framed in that way. So you can
Mm.
answer with that knowledge by combining all this.
Yeah, that's something which I felt as well while learning now medicine in final year. And this is something which I tell in my videos and to the juniors who ask me. I personally believe that second year is actually the most important year in MBBS. Personally believe that. Because if your second year is good, your clinical subjects just it's just like revising the second year. Because in medicine all we learn is we start with the pathogenesis, the pathology and physiology, then we go to the microbiology part or either the investigation part, then we get in diseases in management treatment, we mostly get to that medicines which we learn in pharmacology. So as you said, it's just like if your second year subjects are solid, then you can actually easily get away. But the fact is medicine is just so vast, and that is what makes it incredibly difficult. So I guess very important to ask at this moment is how did you manage your other parts of life? As we all know, it's not just academics, especially during your preparation time, those 6 months of intense learning. How did you go on with the other areas of your life? As well as we all know, you have been running this startup called as Cytokine. And how do you manage all of these things?
So during the preparation phase, I should say like I was doing only one thing, that was preparation, and beyond the preparation, just daily needs, prayers, and everything, and talking to parents, and that is only thing. What I did was I
So no general practitioner working as a GP,
no
nothing
no no
else.
I was not no I was
Nothing.
not working, because I think when you have a short period of time, like almost 6 months or 5 months with you, and if you are not a person who prepared before, like you have subjects to watch and also to revise, I suggest that better not go for any job, because even if it's a job for a 4 hours or a 5 hours, like it will cause difficulties in our flow of learning. So sometimes we will
Yeah.
be waking up morning and we will not be interested in learning, but we will take 1 or 2 hours of rest and then get the interest and learn. Even though at that day we will be losing only 1 or 2 hours. Suppose you are a working person and you are working for 4 hours. You worked 4 hours, you came back and you felt like not learning for 2 or 3 hours. That means that you lost almost 6 or 7 hours of that day. So when you are comparing with a person who is preparing, like using most of the time for preparation, and you are losing on 5 or 6 hours from them. When it comes to a competition, I think you will be at the lower side. But if you are someone who prepared, I know one of my friend who got a good rank, almost like a 2000 something, and got the preferred branch also. So she used to work, and also, but she was very good during her MBBS learning process. She was scored well, very well during the first year, second year, third year MBBS season. So she could manage both. She got a good rank also and required PG seat also. So that is possible. So I think this is personalized, but I would suggest if you are down with the time with almost like 6 months, I would suggest uh, take a drop and don't do the work and the preparation at the same time. But other leisures like talking to parents and working, taking a walk and all can be done. Be social, but avoid social media. That is the thing that you have to talk with the real people than the real people and the Instagram and
Yeah.
everything. You avoid the Instagram.
That's a great tag, I guess. Spend time with real people rather than real people. Yeah, I like that.
I was too much of addicted to the YouTube shorts at that time because I just I would take a 5 minutes break, but I will get into a YouTube short. Then shorts will come on, keep on coming, and we will watch on that. So it was like almost like 2 or 3 days after. I just went to the watch history and watched how many reels did I watch. I was astonished to know that I watched 120 shorts in that short break. So 120 shorts means like, or each of them is 30 seconds, but it is taking almost 1 hour from us. That 1 hour is, whenever I always say that during your preparation time, when you're opening YouTube, you should have an aim. Why am I opening this YouTube? What am I going to search? If you are opening YouTube just for the sake of opening YouTube, you will get carried away. You will watch whatever you want and you will lose your time. So keep eye on all this. And so after this preparation time, I always like I don't like being confined to just this academic thing. Always, I just want to do something other than that. Always. So Alhamdulillah, thank you for that. Thank God for that
Yeah.
mindset which I have got. And so I worked in a hospital nearby, not in the permanent way, but in the substitute. But I used to work like almost 4 or 5 days per week. And also, I like teaching and I just wanted to make some changes in this medical field. So that is the thing, that is the motive behind starting Cytokine or app.
So, what exactly is cytokine for those who don't know, amongst our viewers who are new to this? What exactly is cytokine and what purpose does it serve?
So Cytokine is an app which four of our friends, me, Srihari, Saurabh, and Shyam, we four of them are batchmates of 2016 batch or 60th batch of CMC. So when we were learning for the final year exam, so what happened is that we were learning for the practical exam and we felt too much of difficulty to know which book to refer for the practicals. Like when you go for learning for medicine, there is books like McLeod is there. You have Hutchinson. You have Ramdas Naik will be there. You have Alagappa. Yeah, Davidson will be there. Many practical books. Too much of practical books will be there, and you would be confused which book to refer. Kundu will be there. So what book to refer, where to learn, which from. So we thought that we can make some solution for this, not only just medicine, all the final year subjects. So we thought that if some teacher is teaching all these things in an app, where the correct method of how to write a case sheet is being presented, and also what are the usual questions being asked is also said, and also the Viva questions, the investigations, the management, all that things that you have to know for the practical exam. If a teacher is discussing these and giving these ideas to someone, and if we can provide that for a cheap rate, that would be a great thing that we can do. So that is the way we started Cytokine, and we are very happy that we have got good subscribers and very too much of happy customers from your just senior batch, 60-second batch. Many of your seniors like Hasim and Thomas and many of them. Uh,
Yeah.
thanked very much to our team after the practical exams and final year exams. And many of them could get good scores in their practical exams also. So that is what we did from Cytokine. That was the first thing that we did from Cytokine, which is UG clinics. So the second thing that we did was I said that after my preparation I started doing work. So when I was working in a hospital, when in casualties and everything, what I felt is that though many of the doctors are graduated from many different hospitals and many different colleges, many would not be having the exposure that others are getting. So the treatment protocol and different things will be there, but might not be knowing that. So if we are updating all the doctors who are practicing about the new treatment guidelines and the protocols, and also the usual drugs, and also when we learn, like I think the MBBS syllabus has some issues itself. The same one issue is that we learn from first year to final year, but we never learn the drug dosage and how many days it is given already. Like if I'm asking, Umar is a final year student, but I'm asking you, post class, what is the dose? How many days you are giving? You will not be having anything because no textbook gives you that idea. So during our internship also, many of the hospitals, and including our hospital, we do too much of paperwork rather than learning process. So when we come into the practice per se, and when you come to the general practice, the main thing is that the patient asks you, doctor, how long should I take this medicine? And what is the dose of medicine? So at that time, you'll be confused. So to counter all these problems, we just conducted a program of 19 sessions where we got classes from eminent faculties. They're teaching us the correct management that we have to do, the procedures that we have to do, how to do a correct suturing procedure, how to do incision and drainage, how to give the medications, when to do the cold compress, when to do hot compress, what is the drug that you have to keep, which is the drug of choice, which is the drug which is preferred, when to give an antibiotic, when not to give antibiotic, how to use antibiotic correctly, what is the dose that you have to do, what is the day that, the important things and what minute things, but the most important things when it comes to general practice was covered in that session. And we have got almost like 450 plus participants for that session, Zooms, which was done in Zoom. And the same sessions are available in the recorded version, is available in the Cytokine app also. And I would be happy, like, if you're a practitioner and anyone who is watching this video, you can like approach us and you can watch the demo videos and all, and get use of it if you can. Yes.
Cytokine is all about the practicals to become a doctor and also how to and also the practicals that after becoming a doctor. So that's basically what Cytokine is aimed at. Yeah, so with that, I would now like to ask about your future plans, inshallah, if you have any. And specifically, why did you choose MD General Medicine, even though with your rank you could have gone for radio diagnosis, dermatology, and also why come back to CMC again? Why not other colleges or somewhere north, out of state? If you would like to share that too with us.
Now, I plan for doing MD General Medicine. Many of my friends ask why General Medicine and why not radiology. And the other thing many of my friends and relatives ask is that what is your DM plan? So right now, if you ask me what is my DM plan, I have no plan right now. I have two MD General Medicine. I will be figuring out which DM will be suiting much to me during my residency, hopefully. And why not radiology? Because first of all, if you ask me, when did I like general medicine? I like general medicine right from Thursday. So I loved the patient interaction. I loved talking with patients, and the general medicine subject per se interested me. But when I got a good rank, when I got too much of pressure from everyone, like radiology kind, and you can settle very much easy. I thought like, yeah, I will go for radiology for 2 days. But on these 2 days, I could not sleep well. Like, uh, I could not imagine myself as a radiologist. I did not imagine myself as a radiologist before. So it's not just because like radiology is bad. Or radiology is a good branch, very good branch, very too much of sorted out branch, and only toppers usually get that. But I did not know. But I thought that it won't fit me much, and I am more of a general medicine or after general medicine, if you ask me what are the subject I like, pediatrics. So general medicine, pediatric kind of a patient person, and not into the radiology and the photos the images and that kind of techie type. I'm not too much into the interaction. I like the patient interaction per se. Maybe many of the physicians which I discussed said that you will like finally fed up with the interaction, but I don't know. Like right now, I like the patient interaction. I like to uh, talk to patients and all. So I think general medicine fits me rather than radiology. So that's why I took general medicine. And why CMC is a good question. Like
Yeah.
I did my UG from CMC. Looking
Yeah.
back, if you ask me what is the best decision or what was the best decision which I made, was taking UG from Calicut Medical College, because it's not just about the patient load and everything. There is a good patient load. There is good exposure and everything. But I don't know like how many of the MBBS students use that. But when it comes to other things like good people around you, good seniors, good juniors, good patients, like all the patients in the Malabar areas are too much of cooperative. They cooperate very much. They help us. Some patients say, "Come on, learn with my body." So this is the way that patients gives us the respect and all. So that actually I liked all these, and always when it comes to Calicut, food is a great thing. Too much.
I think Calicut always calls you back, no matter where you go. In any part of the world, Calicut is that place that always calls you back to there. I was actually, when I was doing my neurology electives, the professor there, Dr. Gafur sir, he was also saying the same thing. He did his MBBS from here, then he opted for diploma in ortho in Chennai, and halfway he decided to leave that because it was not his interest, and he appeared for the entrance examination again and got general medicine, and he decided to join Calicut again, and he was saying the same thing. During his entire time in Chennai, the only thing which he wanted was to get back to CMC.
So it calls you back. I don't know how others feel that, but every CMCN will feel that we have to come back to CMC and we have to be back to CMC. So CMC called me back, the seniors, the juniors, and many things are there which calls us back to CMC. So and when it comes to PG, we have a good exposure, and it's regarded as the best college in Kerala and one of the best colleges in South India also. So you have good exposure, you have good patients, and good seniors and good juniors like Umar. So so looking back, everything called me back to CMC. And, being near to home, just it's almost like 46 kilometers from my home to here. It's almost like just a matter of 1 hour of ride to home. So be getting near to home also. Though I'm not too much of a homesick guy, but I'm a bit of homesick also at the same time. I don't know whether I'm a homesick or not, because uh, till now I always used to go home like a weekly once or once in 2 weeks at least. So during the residency, I might feel like whether I'm homesick or not. Correct, in the correct way. So that's it. So that's why I uh, chose Calicut. I had a option to go into Delhi colleges like Maulana Azam Medical College, which is regarded as the best college in NEET PG per se. I think in the first allotment itself, a rank below me, like more than 220 also got MD medicine there. Right. Maulana Azam, but that was not in my list. My first preference was, first choice was Calicut Medical College, and just ended there and joined here.
So I guess may God bless you and guide you throughout your journey. We are really excited for your future. May you become a great doctor as well. And before we end this wonderful session, I would like to ask you one final message for the MBBS students, for those preparing for entrance examination, or even for those NEET aspirants who might be trying to get into medicine. What is one piece of advice which you would like to give?
So, advice to those who are getting into the being a doctor. If you're interested of being a doctor, and like you like to serve patients, and you like to see patients, treat them, always welcome to the world of medicine. But if you are a person who is too much of money oriented, just for cause of money you are learning, I think medicine is not a field for that right now. It was, or it might be before, but right now it's not, because there are too much of doctors here, and if you are just a money-oriented person, you will be just tiring out of not getting too much of money and not being happy. So that's the thing. So those who have entered MBBS, you have entered a good profession, your professional course. It's a great thing, and congratulate all of you, because getting into MBBS is also not an easy job, because you have worked hard for this. So give value, because you have been gifted with something. So give value for that. So don't waste your complete MBBS time by just sitting idly and not learning anything. Like in college, the main thing is that you learn just a day before the exam and you just pass. That is a method that we follow. But I think we have to do a bit of justice to that also. We have to learn a bit more than that, not just learning on the day before. Though you can, I'm not saying that you don't have to play on everything. You can play, you can enjoy, you can have every fun and everything. But the time that you waste in social media, in a sense, like what, just by watching reels or playing games, that you can use a bit of half an hour or 1 hour every day just for the learning process also. Because every piece of information that you have will be benefiting the patient. Like even if you are just an MBBS, I have seen many of the doctors who just has MBBS but have too much of patient load than who have done super specialty. Like nearby my home, there is a doctor who has a daily booking of 60 to 70 patients, and he's having a good patient load. He finished MBBS. You also did MBBS. I also did MBBS. But what is the difference? He has good information, good knowledge about the diseases and also the medicine and management. So which makes him different. So if he has a good knowledge in that medicine and everything, he can do a good practice. So every knowledge that you have will benefit in one or another patient. It's a subject where your knowledge will be benefiting others too much. So learn well, and also be good and be kind to patients, and be active in some type of charity programs or anything if your college is having any of them,
Yeah.
because that also will be helping. And also like be connected with your parents, and because till now, when you are coming into college, you might be with your parents, but after you are coming to college, you will be like disconnected with them, like but try to always connect with them, call them every day. They will be very happy to know that, they will be very happy that you have got into a good place or good course, and they will be very happy when you are keeping the touch with them and calling them and asking them everything, even when you are getting into a college and then college life. So uh, that is the thing that you have to do. And also, like, I believe in God to this. So believe in God if you are a believer, and
Yeah.
do the deeds, good deeds, increase your good deeds, which will be benefiting, because uh, just the day before the exam, you will be not knowing anything. You will be forgetting everything. You might not be remembering anything. At that time, the only hope that you will be having is God. You will be calling out to God, "Oh God." I think atheists will also call, "Oh God, help me."
Yeah.
So I'm not doing any offense to anyone, but I'm just mentioning. Like many of the atheist friends also did the post the WhatsApp status during that time. Oh God, help! So that's so it helps us because if we do good deeds, I think good deeds will come to us. So that will happen. So main piece of advice. One thing is that believe in yourself. That don't demotivate or underestimate yourself by saying that I'm not a government medical college student. I'm a private college student, so I'm not going to get. No, many of the students who are getting good ranks are also from private colleges, and also many other colleges, or foreign graduates are also getting good PGCs. So don't underestimate yourself. And second one is that revision is the mother of memory. Like you might be feeling like some of the your batchmates are too much of gifted. They might be knowing everything just by reading once, but you can reach into their level just by reading 10 times or 5 times according to your level. So you can reach them by revising. So revision is the mother of memory. So do that. Then third one is that always do PYQs, and follow the PYQ, because whatever be the exam will be having a pattern. Whether if it is your final year exam, your university exam, what you have to look for the last 5 years previous questions, third year exam. Look for the last 5 years previous questions. What you will see is that there will be a pattern. from the area where the questions are being always asked. So you can predict the questions. Like if you ask me in the NEET PG 2023, when I was going for the exam, I had in my mind like almost 160 questions will be from these and this area. So that
Mhm.
those 160 questions were from those areas. So that is the way that you have to approach the subject and approach the exam. You have to know what the examiner wants and the examiner asks you. So for that you have to concentrate on previous questions, not on like many modules will be there, many Q banks will be there, but do the PYQs first. So
Mhm.
you know what you are going to attend by knowing what was asked in the previous years. So there is a high tendency that the same pattern and the same areas will be repeated. Then
Mhm.
the same questions. Sometimes the same questions will also be repeated, but there is a high probability that the same areas will be repeated. So, and the fourth one is that be effort oriented. Like almost
Mhm.
sometimes we are too much of result oriented. Like
Yeah.
I did 10 hours of work, but I did not get this result. So when we are becoming too much of result oriented, what happens is that the stress builds in. But when
Mhm.
you are effort oriented, like I did 8 hours of work, I think the result will be coming at some point of time. I had my one
Mhm.
of my friend who did extensively well during the learning process and everything, but the EPG exam, I don't know what happened. Something happened and his results were not good. He ended up like a 3K or 4K rank. But I believe, and he believed himself too much, and he prepared very much well for the INICT exam. And in the May INICT exam, he scored a rank of all India rank of 36. And he's
Mhm.
doing radio diagnosis in
Yeah.
PG Merchandise, Habib Naufal, Dr. Habib
Yeah.
Naufal. So this is that he was, I think, effort on it. Like he put in his effort, so his result came, though it was late. Though it was late
Mhm.
for a 6 month or just it was a late month, late of for 2 or 3 months, but the result came. So if you have put your effort, the result will come.
Mhm.
And the fifth thing is that stick on to the the coaching notes that you have. Like don't go behind the form. Like you will be if you are following some platform. Suppose you are following narrow for a subject, follow that subject.
Mhm.
Don't follow same subject from different platforms. If you
Mhm.
are following DAMS, follow DAMS. If you are doing battery, do battery. That's it.
Mhm.
Stick on to that notes because all these faculties who take this class in all these platforms are too much of experienced. They are having experience of 10 or 13 years. They have seen all years these questions. They know what are the previous questions. They know what are the important areas. So their classes will be mentioning all these things. So
Mhm.
learn and stick to that notes. Don't go beyond the notes. Don't go beyond the notes anyway. Because like when you are doing like Maro Cubans, you will be getting too much of other knowledge, which I say lateral reading. I call it
Mhm.
lateral reading. Avoid lateral reading because lateral reading enhances your knowledge and you will get a good idea about the subject and all, but it won't do too much good or any good for your entrance exam or entrance level. So, uh, so like read only the things which you can revise. So that is the thing. Like if you are reading too much and if you are not able to revise them, do use. Then, yeah, almost always the last thing.
Mhm.
Stay away from the social medias when you are preparing because that is very important. Only like sometimes when we have to get something, we have to leave something. No pain, no gain. So
Mhm.
or avoid the pain of not being chilled by the YouTube shorts, but you will be having a gain of PG rank or something which fits you. Anyway, so that's all.
That's a great way to end this video. When I was starting this YouTube channel, my primary purpose was actually to serve as much as value which I can provide to the audience. And I guess without any doubt, I can say that this is the video which has which will provide hopefully the most value in terms of the videos which I have produced. I'm sure about that. And once again, I guess it's time to end this wonderful session. I would like to thank Dr. Thanveer for your patient time. We have been trying to get this done for a long time right now. Months have passed, but this is the time, and I'm really happy to have done this. I'm sure that the audience will definitely benefit a lot from this video, and we all definitely pray for you and hope the best for your future as well.
Thank you very much, Mo. Thank you very much, and I am so happy that you have started a YouTube channel. And
Mhm.
um, I, I always like admired you as a junior because it's a great thing. Like we have to do something for the society, something for the juniors, or something some mark we have to do. Help others who are like we are in this field of medicine, and helping others to get into this field is a good, great thing. And helping others to getting to know what is being happening in this field, and guiding them is also a great thing. I am so happy that you have started a YouTube channel, and I hope that you reach into too much of you can reach into too much of audience and help them in some way or other. Because like if you ask me, like many of the YouTube channels, I have followed many of the YouTube channels during my preparation, like for knowing the content and like how to prepare it. Like there was one YouTuber which I should mention, but Dr. Milind Shinde. He is doing a YouTube. There's a YouTube channel. There is, I don't think there's too much of like 200K or any subscribers there, but all of his contents were too much of useful for me. Like even like when I got the entrance, when I got the seat, all the time I would remember him as a great person who influenced too much in my life. So I think that you can also be an influence in many of the juniors to come and play a good pivotal role in their life. Thank you very much, and thank
Thank
you for the
you.
interview. And I hope this was something like something which is useful for you and the
Definitely.
audience. Hopefully,
Definitely. Yeah.
thank you.
Thank you.